Welcome to Bloodborne Pathogens, Part 2. I'm Markus Wesaw, and my contact information is listed on the screen, so if you have a need to contact me at any time about your questions, feel free to do so. The objectives were covered in the first module in Part 1, so if you'd like to review those again, just hit pause on your video player and read those at your own discretion. So in this particular module, what I'd like to do is go over briefly universal precautions and what it really means. Universal precautions, most of all, is a mentality. It is a mentality that we adopt and we say all potentially infectious material, all human blood is infected. We treat it as if it's infectious, that it's going to cause a disease of some sort, and we want to have nothing to do with it. And so if you can get that mentality in your mind and you adopt that school of thought, what you'll find is that this mindset will force your body to say, hey, I want some kind of personal protective equipment, I want to wear gloves, and you remember better. And that's really what universal precautions are. It's saying every blood, all OPM is infectious, and we don't want any contact with this substance. Work practice controls. There are many different types of work practice controls amongst different industries, but what I've done here is focused on gloves, especially latex gloves or nitrile gloves, since those are the two most popular kinds, and how to appropriately address the most common and general work practice control measures we can take. So first and foremost, I want everybody to understand how important it is to wash your hands after you remove the gloves. Now, I've seen doctors, nurses, and other healthcare professionals even forget this, and it's very common. So if the professionals are forgetting it, imagine how many people who don't work in that industry react and behave after they remove their gloves. So washing your hands with warm water and soap after you take off your gloves is always a really good practice. Now, the second bullet point here is quite important as well. Make sure you have a pair of gloves. We just talked about universal precautions and how we're going to treat all blood and OPIM as if it is infectious. So that means we need to be able to get our personal protective equipment when we need it. And so if you can't carry it on your person, if it's just something that you don't deal with a lot, make sure you can find a pair of latex or rubber gloves in your first aid kit or Bloodborne Pathogens kit. Now, the third bullet point is quite challenging because if you are dealing with some type of human blood or OPIM and you have your rubber gloves on, it's very difficult not to touch other objects. And think about it. If you need to write something down, you're going to grab a pen. If you're going to open a door, you might grab the doorknob. So think about how difficult that is and how we often forget that. And so make sure that we're very cautious when we are working with our rubber gloves so we don't contaminate other things that might not get decontaminated or sterilized later. And finally, contaminated gloves need to go into a biohazard waste container. That's a very good best work practice. We don't want to throw those in the general waste basket because what we could do is potentially expose another person to this biohazard or bloodborne pathogen. So with respect to gloves, it is important to remember that latex, nitrile, and other types of non-permeable gloves are indeed personal protective equipment, and therefore they have certain limitations. And one thing I need to address is that there are many people who are allergic to certain types of gloves. I know people that are allergic to latex or nitrile gloves, and so they need to find an alternative. But the most important consideration when we are selecting non-permeable gloves is just that. They have to be non-permeable. I don't want to see anybody using leather gloves or cotton work gloves as an example, because the blood or OPIM can potentially saturate those materials and create an event whereby an employee is exposed. Now, every situation is going to be different, and as we know, personal protective equipment is always going to require some type of an assessment. So, if we're dealing with a very minimal amount of blood or OPIM, the latex or nitrile rubber gloves might be enough. If we're dealing with quite a bit more and it's justified, we might have employees consider wearing safety glasses or face shields, or maybe even some type of bloodborne pathogens apron. Okay? All these are just different forms of personal protective equipment, and we have to use our best judgment in order to determine what is going to work in the most appropriate fashion. I want to talk a little bit about sharps disposal containers, and something that I have seen professionally in the last year to 2 years possibly within different industries. Now, a lot of employers have employees who suffer from diabetes. They're diabetic individuals. And some of them take insulin to control that diabetes. And so what I'm recommending is not calling anybody out, and we don't want to say, hey, all you diabetics, line up and come over here. We need to talk. I don't want you to do that, but it is nice to have a sharps disposal container in the workplace when that is a consideration. So they have a place, a safe place to put used needles, and that way they don't have to keep them or store them and put them up when they go home. So this is a really good thing to do. If you have a public facility, sometimes it's good to put those up as well for the public. That way we don't have needles in the waste basket. A lot of people just throw them away as if they're common waste, and we want to avoid that. Just a very easy way for an unsuspecting employee to have a needle stick injury, which really freaks a lot of people out, and it can be a very scary experience. Moving on, I want to talk to you a little bit about the red biohazard bags. Now, red biohazard bags, whether you have them in your workplace or not, if you're in healthcare, you definitely have them, but if you're not, and you're in some other type of industry outside of healthcare, one thing I want to drive home is that the biohazard bags are not for sharps. So we're not going to put broken glass, we're not going to put metal shards or anything that's come into contact with blood or OPIM, and we're definitely not going to throw needles in there. So that's not for sharps. So anything that can tear the bag, rip the bag, we don't want in the bag. So can you put clothing or gauze or rubber gloves in there? Of course, that's what it's for. But I just want to drive that home. It's not for anything that could potentially break the bag or tear the bag. I want to talk to you a little bit about decontamination. Now, decontamination, for the most part, is going to entail some kind of solution. And usually what the industry standard is, it's going to be a 10% bleach solution and a 90% water. Okay, so basically we have a 10%, 90% setup, so a solution is strong enough to kill HIV, hepatitis, and any other known bloodborne pathogen. And so tools and non-porous substances or non-porous surfaces such as tile, they're all great to just use a bleach solution and do a proper decontamination there, proper cleanup. Keep in mind that some clothing, we can wash it, we can get rid of it if we want to. I recommend getting rid of clothing that if it has any blood on it. Some people, they don't mind and they'll just wash it, wash a garment that they may have, and then reuse that clothing article later. But some PPE can be reused. It's all going to depend on permeability, whether it's permeable or not. So here's my recommendation. For decontamination purposes, anything that is porous or permeable or can be saturated or was saturated, what I recommend is just throwing it out. Throwing it away into a biohazard bag and incinerating it or conducting some other formal type of decontamination or disinfection with that. Typically, just throw it out. Equipment and tools, as long as it's safe, I would use a bleach solution or another product that is designed for that purpose. Again, contaminated laundry. What we really want to do with contaminated laundry is we want to prevent exposing other people that may be unfamiliar with it. What I see a lot is I see people throwing different types of gauze, first aid materials. They'll throw it in the general waste basket that you would use for a pop bottle or Coca-Cola bottle or something like that. And what that does is it continues the chain of contamination. So we want to make sure we limit exposure to other people whenever we can. A biohazard label, as you can see here, the symbol for a biohazard is clear. And anytime that there is a biohazard of any sort, okay, such as at a laboratory or at a medical healthcare facility or even on your sharps disposal container, you would put biohazard labels there. And so any type of area, whether it's a refrigerator or a freezer, if you're storing a biohazardous material, waste containers, anything, that's pretty much where you're going to use a label. So anytime that there's a potential bloodborne pathogen, always use the biohazard label and you'll be squared away. I want to talk next about the hepatitis B vaccination. First and foremost, when employees sign on to a new position, or it is like a new hire type thing where they just got the job, or they're transferring from one position to another, but this new position has quite a bit more risk for bloodborne pathogens, the employer must offer a hepatitis B vaccination within 10 days of that initial assignment. Now, this has got to be provided to the employee at no cost. So here's a scenario. Let's say that you don't like vaccinations. You're against them for whatever reason. They scare you, or you just don't want the hepatitis B vaccination. You have your reasons. Well, you can decline the hepatitis B vaccination if you so choose. That is perfectly okay. Now, the employer is going to ask you to sign a form declining the hepatitis B vaccination, and that's your right if you want to decline. If you accept, then you just go and you get a series of 3 injections over a period of about 6 months. And a lot of employers think that this is really expensive, and why would we want anyone to have a Hep B shot for the vaccination process? And most of the time you can get these Hep B vaccinations at a public health facility for anywhere from $7 to about $20 a person, depending on where you're at and what the scenario is. Okay, so let's go ahead and move on to what happens if you have some kind of blood or OPIM exposure that occurs with a sharp or maybe unprotected skin. You have to report it. There's no way around it. So if you get a needle stick injury, or if there's broken glass that had blood on it, or any type of machinery that had blood on it, you come into contact with it, you have to report that to management, and you need to inform them how the incident occurred, what you were doing, in other words, and why it happened, where at the work site it happened, and what part of your body was affected. Okay? Any other details like what PPE you were using, what you were doing, or the specifics of the incident should be reported immediately. Now, after that, you're going to have to seek out medical attention from a medical doctor to see what the best course of action is at that point. Most of the time, there's a standard protocol where a medical doctor will perform some tests over time in order to make sure that they identify any HIV or hepatitis exposure subsequent to this exposure. And so it's very important that you follow the right procedures. And then if you're curious, if you're in management and you're curious, well, is that an OSHA recordable incident? And it would be if it involves bloodborne pathogens, even if it's a typical first aid type of scenario. So if it does involve a bloodborne pathogen, it is OSHA recordable, and that will go on your OSHA 300 log. That can get a little tricky from time to time, so if you have a question about that, feel free to contact me. And finally, as we wrap up our presentation here, medical records. Now, medical records are confidential and must be provided to the employee within 15 days upon request. And the employer usually maintains these records for 30 years after your last day. And so one of the things I tell people, just as a really good recommendation, is that companies go out of business, companies get acquired, companies merge, things change, doctors retire, and so my point here is that medical records are supposed to be well kept, but realistically medical records are sometimes hard to track down over time. And so my recommendation is, if you want your medical records, get them as soon as possible and file them away somewhere, or get a copy and then have your general practitioner or your regular doctor file those in your medical record that you know is going to be safe and sound. And don't wait too long on those medical records, but ideally you always have access to them. This presentation is now over. Again, if you have any questions, feel free to contact me at your discretion, and we can go from there. Have a great day.